Well, you might have heard the news like I did that some are saying that the pandemic is over and we're back to normal, whatever that means. But really, is it over and are we back to normal? So let's talk about that today. So stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. So my guest today is Dr. Meg Fisher, and you know that she's been with us before. She talks to us periodically. Hi, Dr. Fisher.
Glad to be with you again.
Yeah, so for those who might not know, Dr. Fisher is the acting deputy commissioner of public health in New Jersey. So I feel like, Dr. Fisher, you have a pretty good handle on what's going on. And so what do you think about those remarks that we've all been hearing just in the last, day or so?
Well, I think that each of us is in a unique situation and we have our risks and it's not the same for everyone.
Right.
What we know is here in New Jersey, we are still seeing lots of disease due to COVID-19. We still have 900 to 1,000 people in the hospital every day with COVID-19. We're seeing deaths between 5 and 15 a day. So while, some may like to think the pandemic's over, what I would say is we still have a lot of COVID. And as was also mentioned, COVID's an important thing, and we need to really think of what we can do to protect ourselves and protect our loved ones. And what's necessary is going to be different depending on what your individual risks are.
I always think it's important to remember that everyone is different, your risks, what risk you're willing to take, your health situation. So it's not like a one size fits all. I mean, it never was with COVID, but maybe now more than ever, we have to really sit back and say, well, what's going to be right for me?
That's exactly right.
So what is right? We know that there's a new booster. So let's talk about that.
Oh, fantastic. That is a great place to start because we know that one of the best, most important ways you can protect yourself is to get immunized. So the new booster, this is really good news. The new booster will protect you. It will boost your immunity for the original strain of COVID-19 that was out there. But now, in addition to that, it will increase your immunity to the Omicron variants, BA.5 and BA.4, that are currently the main strains that are circulating right now. So you can get a booster and protect yourself from what's going on in the neighborhood. Who should get a booster? So boosters are recommended for everyone 12 years of age and older. You have to have completed your primary series. So you have to have gotten 2 of your primary doses. And then it needs to be 2 months after your last shot, whether that was a booster shot or whether that was one of your primary shots. So that means that most people in New Jersey are eligible for this booster. For children, they are also eligible. Children 5 to 11 should get the monovalent, the older booster, only because the bivalent is not yet approved for them. Now, I say that as not yet because we're expecting it to be approved within the next month. So, and things can happen very quickly.
Yes.
But I anticipate very soon it'll be everyone 5 and older. We just started immunizing those under 5. So they haven't yet finished their primary series. So that when they're ready for boosters, I expect we'll have a booster for them as well. Why are boosters important? Because your protection doesn't last forever. And we know within a few months following your last booster, that protection drops down, and this helps build you back up again.
So if we go to wherever we would go to get our booster, and I know for me, it would be a particular, pharmacy locally, will they automatically be giving out that new and improved one? You don't have to ask for it?
That's correct. You can always ask, you can always check with them just to be sure. But
Okay.
the older boosters, the monovalent ones, are no longer to be used as boosters. They're only to be used for your primary doses. So for those original doses.
So we, so
yeah.
we would have had the original, and then we would have had, let's say, our first booster, and this would become the second booster.
And for some people, they may be on to their third booster.
Oh, that's true. That's true. Yeah.
Remember? So yeah.
right.
So this would be the most recent booster, and it'll be the one that's to protect you against what's circulating now. So if you think about it the same way we think about influenza,
Yeah.
for your flu shots, every year the flu shot's updated to make sure it's working for what we expect to be going around. Well, this is the same idea. So now we can give you an updated booster that will protect you against what's coming around now.
So, but to be clear for everyone, including me, even though you have all your boosters, all your shots, it doesn't mean absolutely that you might not still get COVID, but you would have it at a much lower level. Chances are you're not going to go to the hospital. You're going to, get through it.
That is exactly right, and I'm glad you said it that way, because I think a lot of people got confused. We overpromised at the beginning, saying these vaccines will protect you. You'll never get COVID. No, you might get COVID. Vaccines aren't 100% effective, and really, what the vaccines are geared to do is to keep you out of the hospital and
Right.
keep you alive. So very important and a very good point. You still may get COVID, but we don't think you'll get it as severely, and we'll keep you out of the hospital, which is important.
Yeah, well, I think that's everyone's goal, is to not go to the hospital. But okay, let's just even clarify further. Should you get COVID, in spite of our best efforts, so what would be the protocol now? What do we need to do? You probably have, like most people, I have, the rapid test at home. I've gone
Good.
through them like crazy.
Good.
And so let's say I test positive at home with my rapid test. What should I do now?
Okay, so the first thing you should do is you should call your doctor and find out if you should get a medicine to help you get better more quickly.
Okay.
Particularly if you're as old as I am, then I would be calling my doctor right away, because I would want to get Paxlovid, which is the medicine you can take by mouth to prevent you from getting sick enough to go to the hospital. There are also some other medicines that are available. So that's the very first thing you want to do, is talk with your healthcare provider and find out, would you benefit by treatment right away? All of the treatments for COVID work best if they're given, promptly. So sooner you get them, better they work. The next thing you should do is you need to stay home. You need to stay home, and even at home, if you have other people in your home, you need to be wearing a mask. So that mask, remember, is not just to protect you from getting infections from outside, but it also protects other people
In the
because
house,
the
yeah.
virus that you are shedding won't get out into the air. So you need to do that, and you should do that physical distancing. You should really try to stay away from that. And since I've had COVID in my own house, I know that those things work. Masks and keeping away from other people. My nephew who lives with me is a teenager, and he's had COVID twice and has not given it to me or anyone else in my house. So it works, and it's hard, it's difficult,
Yeah.
but it absolutely, you want to be isolated for at least 5 days. If you still have symptoms at the end of 5 days, then you should be isolated for a little bit longer. And now with the home test, you can also test and see if you're negative. If you're
Yes.
negative by 5 days, and if you don't have symptoms, you don't have fever, then after 5 days, you can leave your house, but you still need to keep that mask on. I have my mask always close at hand. So you need to keep that mask on to complete 10 days. So people who have COVID need a mask for 10 days. For at least 5 days, they stay isolated at home. And then if they're well and no fever, they can come out of their house, but they still need to wear the mask.
Okay.
Now, the other thing that people forget is, oh yeah, they wear the mask, but they go have lunch with someone. No, you can't do that. You can't do that for that 10 days. You really should not be sharing airspace with other
Yeah.
people for that
Yeah.
10 days.
Some people haven't really accepted the full meaning of quarantine or isolation.
Correct. Correct.
Yeah, yeah, totally. I see that all the time. All right, so I mean, the good news about all of this is when I think back from the first time that we were together on Zoom and we had this conversation, and it was such a different world then. And of course, we didn't necessarily have vaccines. We certainly didn't have oral medication. So we've really come a long way. And the idea that we even have the home testing, that we can test very quickly and find out what's going on and take medicine and not have to go to the hospital, which is the goal.
Absolutely.
Totally the goal. So that's all the good news. I feel pretty good about that. So if for the oral medication though, would there be some people that it wouldn't be suitable for?
Yes, it does. The Paxlovid has a number of drug interactions. So there are
Okay.
certain medicines, if you're on certain medicines, you can't take both of them together. So you either have to stop your medicines or some people who can't stop their medications really can't take Paxlovid. But that's why you talk to your doctor about
Right,
it.
exactly.
Because they should know. And sometimes the pharmacist will also be very helpful in telling you whether or not there's any other medicines that you're on that might interact.
All right, so I feel like this is good news. I really
Yes.
do. So it makes me feel very good about getting, because I wanted to get the new booster. And honestly, Dr. Fisher, I was waiting to talk to you to hear what you had to say. But now that is on my to-do list for this weekend. See?
I got mine last week.
Okay, I definitely feel a lot better about it. And it really does seem, as we get deeper and deeper in all of this, that every year, just like there's a new flu shot, maybe every year there's going to be a new COVID shot. So
Yes.
does it seem like maybe they'd even be combined, or is it going to be, you got to get one, you got to get the other?
Well, the companies are actually are working on that. They're seeing,
Ah,
can they combine the two? And they're also, the companies are trying that messenger RNA technology for influenza. So we may actually have a better flu shot and a flu shot that can be given along with the COVID shot as just one shot.
wouldn't
And
that
we're
be
not going to
great?
have it this year. We're not going to have
No,
it this
that's
year, but
right.
maybe next year.
So also reminding everyone that, especially if you're part of the vulnerable population, which, well, we are, get your flu shot. Let's not overlook that too, right?
Yep, and there's also a little news there. There's now a recommendation by the Centers for Disease Control and Prevention that people who are 65 and older, that they get specifically the high dose influenza vaccine or the vaccine that comes with an adjuvant. Now, an adjuvant is just another thing that goes with the vaccine that helps enhance its ability to work. So there's nothing dangerous about it. It just makes you react better to the vaccine. So there are three specific vaccines that are now recommended for people over 65. So when you go to get your flu shot, if you're over 65, be sure to ask for the vaccines that are specially designed for you.
Well, would not the pharmacist just look at your age and kind of know, or do you have to ask?
Well, if they just have a script, they're not going to ask. Or if you just go in and ask for a flu shot, they're not going to ask your age, or they shouldn't be asking your age. On the other hand, you're right. If they want to offer you the best vaccine, they actually should be asking your age. But a lot of times they're not. People don't like to tell their age or not or whatever. And I guess it's not really the pharmacist's job to always do that. So take care of yourself.
We need to say, okay, I'm 65 plus. I want the better the better flu shot, the better whatever it is.
I want the flu shot designed for me. I don't want to say one's better, implying that the other ones aren't any good.
Okay,
but the one
that's,
that's specially designed for me.
I'm taking notes today. Yeah, I just look at this. I know there's still people out there, they don't want to get their shots. That fine, everyone makes the choice. But I just feel I feel very strongly for me. I want to be part of the solution, not part of the problem. And I'm just doing my part for myself and my family.
Of
Because
course.
speaking of families, it's fall and a new round of holidays are coming up. And I don't, can we feel better this year than we did last year about gathering for the holidays?
Oh, absolutely. I think we can feel a lot better, but I think we still need to individualize it. So if you have someone in your home who's getting cancer chemotherapy, who's immunocompromised, that's not the time to bring in a whole bunch of people from all over the place who might expose them not only to COVID-19, but to the
Just a
flu
cold or
to
anything.
the common cold that could really get them in trouble. Respiratory syncytial virus is already circulating. That's a virus that causes trouble for very young infants, but it also causes trouble for immunocompromised adults. So I think as you think about the holidays, if there's someone that's particularly compromised, that's a person, maybe they come to your gathering, but they don't eat at the same table, or they don't, you
They sit at
arrange
the
something
children's
where they're
table.
protected, right? Right. Or they sit
Without
at
the
a special
children.
table.
Yeah.
And usually it's too cold to eat outside, but you make some arrangements so that they're not thrown right in the middle of a bunch of people.
Well, naturally, I feel that's good advice for getting COVID. Anyone who would be compromised, it wouldn't be responsible to be around a room full of people, because potentially a cold could be very serious for anyone in that situation. So, I mean, that part of it never changes. But I guess I don't know. Maybe this is a funny question, but should we let go of that fear of like, oh my God, I'm so afraid of getting COVID. And now that you've had COVID as well, and so many people that I know have had it, and knock on wood, have been okay. So should we let go of that death-like fear?
Yep. Now I do have to say, I have not had COVID yet.
Oh, I'm sorry. I thought you said,
I got the shot. I
You
got
had
my
the shot,
shot.
okay.
I got my booster shot last
I'm
week.
sorry, you didn't have COVID.
Right. And as a matter of fact, even though someone in my household had COVID,
Oh, I
I didn't get it
wasn't you.
because
Okay.
we actually, we actually did the isolation, and it
Yes.
works.
Yes.
The isolation works. If you stay away, you won't spread the disease. Now, some people are contagious a day before they, know it. That's something we're never going to be able to avoid, and it's true with lots of infections.
Mhm.
But as far as that fear, I have to tell you, I still have a healthy fear. I mean, I know there's medicines, but I still don't particularly want to get COVID.
No, of course.
So I think it really depends. And there are other people who really have health issues where COVID could really just put them into a downspin. So there are lots of families where they decide if they're going to gather, they're going to ask everybody to be immunized who's going to come to the gathering, and they're going to ask everybody to test. And now with the home tests, that's actually a very reasonable thing to do.
Yeah, lots of people talk. Yeah, it's very reasonable.
Everybody who's going to come, you have to test. I've been to a few meetings. Not most of my meetings are virtual meetings, but the few in-person meetings that I've been to, testing has been done, and everybody's masking. So masks aren't gone.
No, they're not.
Can still use masks, and they're still appropriate when you're with groups that you don't know, and especially groups that have come from here, there, and everywhere, where you just don't know what people have been exposed to in the meantime. So you can still wear your masks, and it's very reasonable for a family to say, we want to get together for the holidays, but we want to be as safe as we can. So number one, if you're sick, please don't come. I mean, that should be now.
We should say that anyway. Yeah.
Yes, that should be the way we do things now and in the future. If you're sick, please don't come. if you're
Right.
sick with an infectious disease. Now, there are other reasons that you may be sick with something that's not contagious. That's different. But if you have symptoms of COVID, please stay home. Symptoms of COVID and the flu are pretty much the same. So stay home if you don't feel well. That's number one. Number two, go ahead and test before you go to an event. Now, one thing I don't want you to do is, oh yeah, you really feel lousy and you have a runny nose, but you test and it's negative, and then you decide you should go to the event. No. That just means, all right, you didn't have COVID, but maybe you have the flu. So, if you have the symptoms of COVID, runny nose, headache, sore throat, those are symptoms of a contagious disease. You're putting other people at risk. Stay home until you feel better.
Well, I feel like that's the symptoms of a head cold too.
Yeah.
Any kind of so you shouldn't be around people that way either. You shouldn't go to work that way. You shouldn't go to a party that way. So whether it's COVID or a cold, you don't want to be around people. But the symptoms are very similar to what you would have for a cold or a flu. Do you necessarily get a fever with COVID?
If you're unimmunized, you usually do get fever. But if you've been immunized, and you get a breakthrough case, you're going to have milder symptoms. So no, you won't always have a fever.
All right. Well, it is really the onus. I feel like the onus is on all of us to do our part and, be vigilant, not just for ourselves, because nobody wants to get sick, but for our family. And I think of all the people that we all know that are somewhat compromised, and we want to keep everybody safe. You want to keep yourself safe. At least I think we all do. Don't go to work sick. Yeah.
Absolutely.
When I'm out and about at Costco or ShopRite or my usual places, I still do see plenty of people wearing masks, and I feel like it's perfectly okay. You should never feel badly about that. It's just part of the landscape now. It just is.
Absolutely.
Yeah.
You know what? As we go into the winter, this is actually keeps you warmer.
It does keep your face warm. I know. I have to agree. And for me, because I have asthma, so when I go out in the cold, I do notice when I wear the mask, I feel better because I'm not breathing in that ice cold air. So however it looks, I don't really care because, I want to just take care of myself.
You bet.
So we're definitely doing better. That's really the best news of all.
Absolutely.
I'm curious, how is New Jersey doing relative to the other states?
So we're doing pretty much as well as everyone. We're probably not the best in the country, but we certainly don't have the most cases in the country.
Okay.
And as far as how well we're doing at getting people immunized, we're doing pretty well. 90% of people in New Jersey have gotten at least one dose. About close to 80% have gotten at least 2 doses.
Right.
And we've
Good job, New Jersey.
Yeah. And we've now given over 100,000 of the bivalent booster doses. So we want to keep giving more and more, but we're doing well. We have all our schools open. People are being careful. There are still, though, cases everywhere. So, it's not gone. We just have, I think, learned a little bit better how we can live with it.
Well, like you said before, I do have I have a healthy fear of the ocean, but I do go swimming in it.
Exactly.
Okay. So I do have a healthy fear, I guess, of COVID. I just don't want to get sick. I have things to do and people to see, and I don't have time for this. So I'm doing the best I can with it, within reason, because COVID already took, it robbed us all of 2 years or so. And, we'll never get that back.
Correct.
So we want to live, but so let's do our best to enjoy the upcoming holiday season, and just be cautious. Get your shots, right?
I think that's great advice. And I just want to follow up on what COVID has taken from all of us. It's really been a strain on our mental health and
Yes.
the mental health of our children, particularly our adolescents. Suicide has become the leading cause of death. It's a horrible, horrible situation. The public health people just started with a recommendation that physicians should screen everyone under 65 years of age for anxiety. I was a little surprised that they stopped at age 65 because I'm not sure why older people wouldn't be anxious.
Wait a
But I think that it's really, there really are more stresses now than ever. I guess we've been saying that all the time, but there are lots of stresses out there. That it's a very hard time for our children, for our adolescents, but also for all the people who have lost loved ones. It's going to be especially hard when we go through the holidays.
Yeah.
That's a time when the loved one that you want to be with is especially missed. So this is a really important time for us to be checking in on each other, and just saying, how are you? How you doing? How you feeling? Just really give that little reach out to all the people who are out there anxious and worried, and just to let them know you're thinking about them. So that would be my other piece of advice.
With the new round of holidays coming up again, and unfortunately, the anxiety associated with holidays anyway, but we still have anxiety from, within families that don't agree on the protocol, and I can't be around you, I can't be around you. It's been very divisive.
Yes.
It really has, and that's been very unfortunate. So I'm hoping that this year families can kind of agree to come together without all of that, and maybe keep your distance a little bit, but let's try and be united as a family. We're not going to get younger. We lost a lot of time, and it's very disappointing. And that's part of all the anxiety. I mean, I have that too.
Sure. But we've gotten so much better at Zooming and
Yes,
WebExes and
yes.
this virtual coming together. So there are going to be lots of people who can't travel, for whatever reason, whether it's their health or whether they just can't afford to travel. The economy's tough for a lot of people. So now's the time. If you can't reach out in person, reach out via Zoom, reach out, just FaceTime someone, but just check in on people. If you don't want to go to your neighbor's house because you don't like to do that kind of thing, give them a call. Just let people know you're thinking about them and you just want to see how they're doing. And sometimes that little reach out can make all the difference in the world.
I agree. I really do. We're very fortunate in this time of this amazing technology, including we're Zooming right now, Dr. Fisher, that we do have access to this, and it can make a difference. I mean, I've used it to visit with friends and family that are far away, and for whatever reason we couldn't be together. So I'm very grateful for it. But I just miss all the in-person. I miss it, which I know we all do. But I guess we just have to be reasonable. That's the bottom line here, right?
Absolutely.
Be reasonable. Not always easy. I know that. For me either. I'm no different than anybody else, but we're all going to do our part. But for the most part, let's say, Dr. Fisher, I think you've given us some good thoughts here, and we're doing better.
We certainly are.
And let's continue on that upward spiral. And let's see where we are in the next several months as the winter settles in. And I'm going to be very optimistic because I'm going to get my booster. And let's see if that makes a difference for my family and for some of my friends.
Sounds like a good plan.
It does. It does. Well,
and you'll have me back in a few months.
Absolutely, because we have to keep checking in on what's going on in New Jersey. But I think we're doing well, New Jersey. Good job. Good job. Yep. So, Dr. Margaret Fisher, thank you so much for being my guest today. Always a pleasure to talk to you and, get the real scoop.
Thank you.
Okay. And you always like to say, well, what I tell you is accurate as of today. So I understand, but by next week, we could have a whole different scenario.
Great point. Thanks for reminding me.
Yeah, well, that's right. That's right. You didn't say it, so I said it for you. Okay, out there. So if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Fisher.
Take care, everyone. Stay well.